Okay, hopefully tonight I'll give you some techniques that you can take away with you and experience with them. Use them to complement whatever else you are doing, because healing touch is something that complements traditional healthcare. It does not replace traditional healthcare. If I have clients that have come with medical problems and have not had them checked out ahead of time, I will not see them again until they get checked out so we know what we're working with. So healing touch is an energy-based modality. It affects not only physical, but mental, emotional, and spiritual well-being. Putting the client in the best possible state to do their healing. It may not be physical healing, but maybe it's healing in relationships, healing in other aspects. So that is what we are. Putting the client in the best possible state. One of the key things in healing touch that, when we teach classes that we really like to emphasize is the importance of intentionality. Now, I'm sure many of you have said there's no use going there to park because I never get a parking space there. And so you don't. But other people say, well, my parking space is there. So you go and your parking space is there. So one of the key things that we know that helps is the whole mental attitude of the client. If the client feels that whatever they are doing is for their highest good, that it is helping them, then it helps them. I'll tell you a story about my dad. My dad had prostate cancer, and we were at a family wedding, and he was complaining about a problem with his hand. So I was standing beside him. I said, Dad, give me your hand. So I stood there, did some work on his hand, let his hand go. The next morning, we had to head back to Calgary early. And so I didn't hear from him, but I heard from my siblings. He said, whatever this weird stuff is that Betty does, I wish I would have got her to work on the other hand, because this one's better. And after that, when I saw my dad, I said, Dad, would you like me to work on you? He figured he had to strip. I said, oh no, I can work through your clothes. So the key thing is, he didn't expect anything to happen, but he saw the results of what happens. And so he was open to it. And so the key thing is, we know healing touch works, and we know it is so beneficial to people, whether they're getting surgery, getting chemotherapy, getting radiation, etc. And just another story on an aside, in the Tom Baker Center, one of my clients was getting stem cell replacement and had been getting ongoing healing touch for quite some time, and was getting healing touch during the process of getting the chemo and the radiation, etc. But the staff were so dumbfounded when they said to the client, but you're up walking around. I mean, usually people are in bed. They couldn't get it, that he had the energy to get up and walk around like a normal human being. They just couldn't get it. So it is really beneficial. So anytime people are preparing to go for surgery, it is beneficial to have a treatment and preparation ahead of time to put you in the best possible state for your surgery. And then to get a treatment as soon after as possible. Just to give you an example of how powerful this is, and I know we're dealing with the other end of the body, but people that have major reconstruction of the jaw, you know how much bruising and swelling they get. Well, I was in the room at the same time the client came back from surgery, started working on the client. The client never did get any bruising or swelling and was discharged 3 days earlier than what the surgeon said he would be. So you think of the cost saving as well as a comfort measure for the client. And in this day and age, people are looking at cost saving effects And that's something to consider. Something else that healing touch is beneficial for, and I'll give you some of these techniques in a moment, but I just want to give you some background information, is headaches. Most people have some form of tension headache, sinus headache, migraine headaches, and this works amazingly well. People with migraines, the traditional medicine that they take really does nothing to the pain ridge. You can have a pain ridge, it's just like a big unicorn horn, as big as this room. And I had to make a house call on a client, and usually we say pain level of a 10 is very bad. Her pain level was 17 in the dark over her barf basin in bed. I wasn't in the house for half an hour, got the pain level down to a 4. And then she's sitting up eating her crackers, talking to me. So again, very beneficial. And in this area, when we have Chinooks that aggravate a lot of people's headaches, again, very beneficial. People can have pain. And we'll give you a technique a bit later in how to deal with the pain. Anybody that has had any form of surgery, an opening made anywhere in your body, it's really beneficial to have some healing touch work. I tried to send an overhead through, and they don't have such things nowadays. So it didn't work. But I just want, and I know you won't be able to see this, but I just want to share with you an example of the value of healing touch again. This is Kirlian photography of a foot. You can see there's one toe missing on this foot, so we're just looking at the bottom part. So there's a little toe missing here. The interesting thing is with this little toe, the physical toe was there, but it had pins inserted in the little toe. But if you can see, there's a leakage. There's no energy going to that toe. So we can see why we end up with amputations and amputations, because there's no energy going. And you probably have heard of people talking about phantom limb pain when they've had, you know, arms or legs or whatever parts removed. And again, if we do some energy work over where the part was, it takes care of their pain. Okay, so I'd like you to experience some of this energy yourself. So I'd like you to rub your hands together so you get an idea that we are energy beings. We're just not this mass of physical tissue that you see standing up here. Oh, okay. So this one doesn't work. Okay. Okay, so what I want you to do is have your hands nice and soft like this, and I want you to try and bring them together, but do not touch your other hand. Just notice what you notice between your hands. And then go further apart and try and bring them together. Just notice what you notice. And then go shoulder width apart. So what do you notice between your hands? Do you notice anything? Resistance. You notice resistance. What else? Tingling. Anybody notice some heat? Anybody see a color? Color. This is a great activity. It's called an energy ball to play with kids. My young twin nieces, one of them could see a color, the other couldn't. Because little kids aren't as skeptic as we are. And so they could say, oh, my ball is yellow, mine is blue, whatever. So you're feeling your energy field. And probably some of you have been around people that every time you're around them, you get zapped. You feel like they've just sucked you dry. Or maybe you're around somebody else and it's like you just got a boost. okay? Or maybe you've walked into a particular room and the room feels really good. But another room is like, oh man, get me out of here. And they've actually taken a picture where a very angry, negative person had been sitting hours before and found this blob of dark energy where this person had been sitting, and yet the room was empty. So we know the importance of being around positive, upbeat people. So Karen, can you come up, please? I want to show you something, then I'd like you to experience it. And I guess I have to stand by the mic, Karen, so hopefully we can...
The other mic's for recording you for our website.
Yeah, okay. So what I'm going to do is I'm going to demonstrate on Karen, and I'll tell you what I'm doing because obviously you won't be able to see me doing it all. But I want you to experience doing this on one another, just to get a sense of what you are noticing and picking up. So Karen, if you can just turn with your back to me, please. So I want you to start above the head, go down slowly. Oh, stand out. Oh, good. Okay, good. Okay, so start about 6 inches above the head, going down like your rake that you use for raking leaves, right down to the floor. Go down the side. And down the front. This is one of the techniques that we do following surgery to remove the trauma of surgery, to remove the drugs, etc. And if you have young babies, it's really helpful to get them to go to sleep, or even for yourself if you have somebody to do this on you to help you to settle down. So stand up and work on somebody and just experience what you experience. Thanks, Karen. Okay. So just experience with somebody that's sitting beside you, just to feel and notice how powerful that is. So down the side, down the front, down the back. So what do you notice as you're doing that? The person that it's being done to, what did you notice? Notice some heat? Okay, what else? Calming? And that we only did 3 moves. You can imagine if you're on a table or on a bed getting this done for, say, 15 minutes, how powerful that is. Yes?
Would you mind asking how many people experienced that?
Okay, how many people had a sensation of noticing something as it was done to them? Okay, great. Did you notice anything?
No, nothing whatsoever.
And you know what? That's okay. Because remember I said whether you notice anything or not, you may notice something later on, and when you're just standing to have this done, you're not as relaxed as if you were laying down in a relaxed mode. So that can happen. Okay, something else that I'd like you to experience is anytime an incision has been made, whether it's an IV or you've had blood taken, something that's really helpful is to seal that area up. Now, you know, on your veins in your hand, you often get big bruises because you don't have much tissue there to close off the veins. So when they take the needle out, if you can just take your hand, it's almost like years ago we used to have to mend the wool socks when they had a hole in the heel. You're pulling the threads together. So we're just collecting the energy, putting your hand on top, and you do not then get the big bruise. So that's something that you can do. One of the things I often say to females, if they've given birth and they have an episiotomy or an incision from, you know, a C-section, is how important it is to have that wound sealed. Because sometimes people will say, you know, I just don't feel like I got my energy back since I've had the surgery. And as soon as we do some energy work, seal that incision, they get better. Because as I showed you with this, there can be a leakage of energy. So again, very beneficial. Something I'll share with you as well. If you're having blood taken and, you know, they put the needle in and then all of a sudden you've got quite a few tubes that they need to fill and it's not running very well. So one of the things I've learned, and I say to them, don't you touch that needle, and you just move your hand over where the needle is and they can fill up all their tubes. So that's something to think about, so they don't have to keep poking you again to find some other vein that's going to work. And even to get an IV or to draw blood, if you're having problems with veins because they've been poked so many times, again. And you can get the veins to pop up better for you. So that's something. Okay, one of the techniques that's often helpful is if you have pain somewhere. And maybe I'll stand and hold this thing, I guess. I'll just demonstrate it. So one of the things, if you have pain, is if you can put your left hand on the pain area and have your right hand lower. So what you're doing is siphoning off the pain. So I'll demonstrate it on myself and then I'll tell you what to do. So again, my left hand is, say, on a painful area and my other hand is hanging down. So if you've got pain somewhere, just try that. Or if you're with somebody that can do it for you, then go ahead and try it. But give it a try, because it is really quite effective. So your left hand on the pain, your other hand lower, so you're siphoning off the pain. And if it's difficult for you to do it, get somebody beside you to give it a try. And if you find the pain, you know, is getting a bit sluggish, not coming off, then move your lower hand and it'll come off a bit better. When you feel that the pain has decreased, then reverse your hands. And I'll demonstrate, then talk about it. So my right hand goes on the pain, and my other hand accesses the universal energy and fills up that spot that you drained off the pain. So you want your upper hand to be higher than where the pain was. So anybody that's had pain, what do you notice? And we didn't do that very long, but what did you notice? That make a difference? Have doubters in here, do we? But this is something that really is quite beneficial. You know, when we bang our funny bone, what do? We hold it. And that, again, is another, it's called hand still in healing touch. When we come from the dentist, I'm doing this, moving the trauma of what the dentist did. So it's hands in motion. It's another technique from healing touch. So simple things that we already know and we already do. So any questions so far? I see lots of doubting Thomases. Yes?
Will it work to put your hand on it if you're cussing at the same time?
Well, you know, I actually haven't tried it, but let me tell you something. I had burnt my hand on some glass cookingware that usually sits on top of the stove, but this day I had it in the oven. Took it out, put it on top, absentmindedly walked away, came back to take the lid off. Well, you know what that feels like. I could literally feel the blisters forming on my hand. So I'm under the cold water tap. Brushing my hand, and I never did get blisters, but I could feel the blisters forming before I was under the cold water tap, brushing the energy down. I didn't touch my hand, and I didn't take very long to do it. So all I can say is you add it to what you already know and just do the work. So what I want you to do now is we're going to give you a technique that I'd like you all to do, but I want you to close your eyes first. And tune in to either a stress level, a pain level, whatever, on a scale of 0 to 10, with 10 being the most discomfort and 0 being no discomfort. Just tune in where you are on that scale. Get rid of this thing. Okay. So at the end, I want you to come back to that, but I want to demonstrate something that I'd like you all to try, because you've been sitting here for a while, and this technique is one of the techniques we teach in level 1. It's called the Scudder technique, and it's really beneficial for people that have been sitting for a long period of time, traveling, sitting at airports, etc. It helps to move congested energy. So I'm going to demonstrate. Each step is done 3 times. So the first one is you lightly brush across your forehead. So go ahead and try that. 3 times across your forehead. I usually touch, it's just touching very lightly. But you can do it all without touching. Then the next one is, again, we need to have your glasses off, but I'll demonstrate and then you can take them off. So very lightly, you're brushing across your eyes, doing that 3 times. Then you go from the top of the head down over the ears, pull the energy off your earlobes, do that 3 times. Then the next one, we're going from the chin to the back of the ears, and do that 3 times. And we're going to work on our left arm. So what we're going to do is go from the shoulder to the inner aspect of the elbow. We're just going to brush that down 3 times, just to the elbow. And then from the elbow down off the fingers, and do that 3 times. And then go and massage this hand. For anybody that knows about reflexology, we have the whole body in our hands, our ears, and our feet. So we're giving our whole body a massage. And then pull the energy off of each digit 3 times. And then you come down your neck, the top of your breastbone, you have a V there. So you're just going in, clearing that out 3 times. Then we're going down our breastbone off the left waist. Do that 3 times. And then we're going from the back of our hip down to the back of our knees. And then you're going from the back of the knee down off the arch of the foot. And do that 3 times. And then you can have a seat and then go and massage that foot 3 times. And pull the energy off of each toe 3 times. And you know, if it's too difficult to reach your feet, we have what is known as the 3 cans, because we have energy around our hands. You found that with the energy ball. So intentionality, I could be reaching down, working on my feet. So stand up now and notice what you notice. And tell me what you notice. What do you notice? You're right. You're right. What do you notice with one side compared to the other side? Looser? And if you look around, you see some people, you know, one shoulder's higher than the other. So should we go fix the other side? Yeah. Okay, let's go. So have a seat. Okay, so now we're going on the right arm. So we're going from the shoulder to the elbow. And brush that down 3 times. And then the inner aspect of the elbow down off the fingers. Yep. And then go and massage that hand. Then pull the energy off of each digit 3 times. So we're going back to the base of the neck, going in there, clearing that out again 3 times. And this time we're going to go down the breastbone and off the right waist. And do that 3 times. And now we're going from the back of the hip to the back of the knee. Then from the back of the knee down off the arch of the foot. And then go and massage that foot and pull the energy off of each toe 3 times. Now the next 2 steps, I'm going to demo it and then I'll tell you how to do it because I need to turn my back to you so you can see what I'm doing. So watch me and then I'll voice guide you through doing it. So you can see how this step would be beneficial to have somebody do it for you. So what you're doing is reach to the back, to your tailbone, reach up as far as you can, up off the top of your head. Do that 3 times. And then this particular one, for people that carry the world around on their shoulders, tension headache. This is beneficial to break this up and then brush it off. And then notice how you feel right now compared to just doing half the body. What do you notice now? Feel more even? Feel different? So have a seat and I'd like you to go back in, close your eyes, and notice what you notice on this scale again of 0 to 10, whether it's pain, tension, stress, whatever. Okay, would anybody like to say what they noticed from doing that simple technique? What? Lighter? And the tension or the pain or the stress, did that number change for you? Okay. So again, you can see you just did this on yourself. It didn't take very long. So again, in the relaxed mode, you can see how much more beneficial this would be. And I did this at a business a year or 2 ago. And I did it in the morning and went back and did it later in the evening. And the manager of the store said, I never got so much work done as she did because she was there in the morning and she was there again in the evening. So again, it just helps to shift and move some of the congested energy. So any questions? Do you have questions or concerns about healing touch? Those are a few simple techniques. There's many in level 1. I think there's about 12 different techniques that we teach people that they can do for themselves or family members can do for them. The founder of the technique, Janet Menken, was a nurse, and her parents had all kinds of health problems. And the interesting thing, once Janet put this program together, her mother and dad did this on each other daily and their health improved. And they were already quite elderly. So any questions or comments, concerns?
I'll take this mic.
Okay.
Anyone?
Brett?
Thank you, Betty. 2 or 3 questions. First, have you ever dealt with cancer pain?
With cancer pain? Yes, I have.
Like bone cancer pain, for example. And has the technique been effective?
Okay, I can think of some clients that I've seen in hospital with various stages of bone pain, cancer pain, and yes, it has been effective. Give you an example of a client that I was seeing basically daily, except when I was away teaching. And I said to the client, you know, I can get somebody else to come because I'm going to be gone for 5 days. Oh, no, didn't want anybody else. But you know, when I came on the unit, the staff were waiting for me and said, thank God you're here. So it did make a difference, and staff could see a difference in the client.
Could you give us some idea of the costs of doing this? I assume that the patient pays.
That's correct. I see clients, and yes, I do have a fee. It's $70 a session, and the sessions are usually 1 hour.
Is there a book that we can buy? Or have you given us the techniques that you're referring to?
There's some pamphlets out at the front. We have books that we have for class. I certainly didn't bring any. I have the level 1 notebook with me tonight. But the key thing is it's beneficial to do a class, because what you get from a book, I mean, it's better than nothing, but I think you gain more from a class. I teach through Mount Royal University, and the next one I do, I think, is November the 12th weekend.
And that information is on the pamphlet?
Actually, that particular class is not listed on the pamphlet, but if you went to the healingtouchcalgary.com website, the classes that I teach, like I teach in Lethbridge, Edmonton, Saskatchewan, up in the territories, etc. So that would be listed on healingtouchcalgary.com's website.
That's good. Thank you very much, Betty.
Or the other thing on the brochure, I think the Healing Touch program website is listed. My classes are also listed on that website, but sometimes they get on Healing Touch Calgary sooner. Anything else? Yes.
Would this have similar? Would this have similar results to visualization? In other words, relaxing and visualizing your favorite spot in Canmore and relaxing. Would that have a similar type of approach that we're talking about here, a similar type of effect?
You know, one of the things that we do teach in class is the importance of visualization, meditation, imagery, all that complements what we do with Healing Touch. And actually, I just received a CD that's using imagery for people in preparation for surgery. And some of the Healing Touch people have used this with amazing results. And in fact, a friend of mine just had surgery on her second knee, and she started using this technique on her second knee surgery. She didn't do it on the first, and she said, like, it's so amazing how much better the second knee surgery went. So anything that we can do, whether it's visualization, meditation, imagery, is very powerful, and it complements whatever else you're doing. And there's a book, Love, Miracle, and Medicine by Dr. Bernie Siegel, who talks about a client that he was doing surgery on, and the blood pressure and the pulse were very erratic. And the patient was under anesthetic, and he said to the person, he stopped the surgery, said to the person, I want your blood pressure, your pulse at this level. And the client's blood pressure and pulse came to the level that he wanted. And so anything that we can do to complement whatever else is being done is just so powerful. So it does work. Yes?
Isn't this the same as Reiki or another called?
Okay. Reiki is a therapy, a standalone therapy. You have to be attuned by a Reiki master. I have done the 2 levels of Reiki. They use symbols. One of the key things is with healing touch, anybody can learn it. And the neat thing, Janet's image was to have this in every school, every home, every hospital. And you know, to see young kids doing this is so powerful. My young cousin, she was 3 years of age. Her mother was complaining of a migraine. The 3-year-old said to her, "Mom, sit, I fix." Fortunately, the mother sat. The mother said, "I don't know what she did, but I do feel better." Because the 3-year-old had Grandma, my sister, work on her, and she knew Grandma moved her hands. And these young kids will come to the grandmother and say, "Can you work on me?" And another little kid saying to his grandma, "Can you do that vacuuming on me?" Because the kids feel so much better.
This is not the power of suggestion?
The little kids. You know, you can do this. There's studies on doing this in premature babies, and they grow much better. And in fact, there's courses on using this on animals. When the animals have enough, they get up and walk away. So yes, it's powerful. Anything else?
What about vibrational energy? They have discs, they have wands that have just come in from Singapore and been used for 4, 5, 6 years.
Right.
Are you familiar with it? Imago?
I actually haven't had any. I know about them. I haven't seen them. But again, it's another form of energy therapy. So whether you're using wands, whether you're using magnets, whether you're using visualization, it's just another form of energy work. Yeah. I think there's somebody at the back, Karen.
When you did the technique to remove the pain, you used the left hand to wipe away the pain, and then you used the right hand to bring down the universal life energy, you said. So question number 1 is, does it matter which hand you use?
Okay.
For those 2 operations?
Okay, that's an excellent question. In class, that's how it's taught. Left hand on the pain, you drain it off with the right, then reverse the hands and fill it up. But no, as a matter of fact, it does not make a difference, because if I'm doing it on myself, sometimes I have to use the right hand and drain it off with the left. So it does not.
Okay, and then later you demonstrated a whole bunch of regimes where you were wiping the stress and the pain out of the body. Why didn't you follow that up with bringing the universal life energy back in?
Well, I guess because that is the way the technique is taught. You certainly could, but what we're doing is we're removing the congested energy. That's what we're doing.
And you're replacing it, right?
Sure.
If you're replacing it.
That is correct, because we're draining off the pain. And so we don't want to leave, for the lack of another term, a vacuum there. So we're filling it up. Okay? This, we're just moving the congested energy. Okay? Good question. Anything else?
I actually have to say something because I invited Betty here. My husband trained under Betty, and he's an engineer. I want you to know this, an engineer who does healing touch. It's kind of an anomaly. But about 3 years ago, I had the misfortune to have a dog bite off the end of my finger. And I was not a healing touch believer. I kind of went, oh, that's all that hokum crap stuff. And, and so he told me to just do this technique to get rid of the pain. And while I was in Emerge, I did that. My daughter Anna was with me, and she could see the difference in my pain levels. But what was really interesting is after they found my finger and sewed it back on, when I went back to see the specialist, he said he'd never seen a person of my advanced age heal quite so quickly, because normally that only happens in children. And when I said that we use healing touch techniques on it, he went, oh, that explains it. So that's why I wanted you to perhaps see a little bit of what Betty can do for you.
And the thing is, we do know that it is helpful for people with fractures as well, that they do heal much faster. And just to share with you, we have medical doctors who do this. Dr. Mimi Garney from Scripps Medical Center is a cardiologist. She has spoke many times at her conference. She said, I used to call myself a plumber. But what she found was that her clients only started to get better once she included healing touch before the surgery and afterwards. So she is now a certified healing touch practitioner as well as a cardiologist.
Thank you.
Okay.
How about a good hand for everybody?